Hi everyone, thanks for joining this video presentation. My name is Jess and I'm the Research and Evaluation Advisor at Activity Alliance. Today I'm going to be presenting the key findings from our latest annual Disability and Activity Survey. I'd like to start by saying this has been a very challenging year for both disabled people and for the sport and activity sector. We hope that this research can support you to understand the experience of disabled people at this time. So, what is Activity Alliance's annual Disability and Activity Survey? The project launched in 2019. It provides a greater understanding of disabled people's attitudes towards and involvement in sport and physical activity. The survey was completed in June to September 2020. Just over 1,000 disabled adults and almost 1,000 non-disabled adults took part. The respondents were representative of the UK population in terms of gender, age, and ethnicity. It's now in its second year, and the survey plays a crucial role helping to uncover the impact of the coronavirus pandemic on disabled people's ability to be active. It looks at what we can all do to ensure that inclusive practice and disabled people's needs are part of the response to the crisis. So, on to the findings, beginning with perceptions before the pandemic. Though the survey was completed during the pandemic, we also asked people to consider how they felt before coronavirus too. We saw positive changes before the pandemic. Our research showed that disabled people were less likely to be inactive than in the 2019 survey and more likely to feel they have the opportunity to be active. Sport England's Active Lives Adult Survey, released in October 2020, also showed similar positive changes before the pandemic. However, when this is compared to non-disabled people, disabled people are still more likely to be inactive and to feel they have less opportunity to be active. There were other positive changes too. These included perceptions and motivations. We know that a big barrier for disabled people is they feel their impairment stops them being as active as they want. Disabled people, like everyone, should be able to be as active as they want, so we need to remove this barrier. We saw a small decrease from the number of disabled people who felt this way this year. It fell from 81% last year to 77% this year. Disabled people were more likely to feel physical activity and exercise is for people like them. So 57% agreed with that this year, compared to 51% last year. However, disabled people are still less likely to agree with this than non-disabled people. Motivations were changing too, especially for taking part to relax, having something to do, and taking part with friends. This is positive as it suggests that disabled people's motivations are becoming more similar to non-disabled people's motivations. However, top motivations are still around health and staying fit. I hope you can see from these findings, there is a positive shift happening across several areas, indicating that the work that we and many others are doing was making a difference. Now looking at how the pandemic has affected things. Key findings in our annual survey showed that twice as many disabled people, 27%, felt that coronavirus greatly reduced their ability to do sport and physical activity compared to non-disabled people, 13%. The pandemic has also made disabled people feel they do not have the opportunity to be as active as they want to be compared to non-disabled people. 44% of disabled people said at the moment, last summer, they did not have the opportunity to be as active as they want, compared to 29% of non-disabled people. This has risen since before the pandemic, when 30% of disabled people felt this way. It has also risen for non-disabled people, but not to the same extent. This is worrying, as it shows the pandemic is reversing the progress made, and it's specifically worse for disabled people. We also asked how much the pandemic was affecting disabled people's health and impairment, and almost 3/4, 74%, said it had. In the survey, we included an open-ended question where people could describe the impact on them. Many people spoke about how not being as active as they wanted to be affected them, and there are three major themes. Not being active has made people's health and impairment harder to manage. we know that many disabled people use activity to help with their impairment. So the pandemic has stopped this. This could be that somebody can't go swimming, to the gym, or to physical therapy because of restrictions or the facilities are closed. It could be that someone is shielding and they feel they can't get the same benefits from exercise at home or are moving less. Many say this makes them feel less mobile and experience more pain. For some people with long-term health conditions like diabetes, cardiac issues, or asthma, people said their condition had gotten worse over this time. On a similar note, we know exercise can manage mental health. With the lack of opportunities to stay active during the pandemic, disabled people voiced the negative impact this was having on their mental health. We also saw that disabled people who used to exercise and be active with friends or in groups found that they missed out on this, on the social benefits, and felt more isolated as a result. Now looking at barriers, we know about the general barriers that disabled people face, perceptions around their impairments, the attitudes of others, as well as logistical and practical barriers. The pandemic has introduced even more barriers. These are experienced more for disabled people than for non-disabled people. The most common new barriers are the need to self-isolate and shield, a fear of contracting the virus, and the impact on health. This isn't necessarily the direct impact of having the virus, it's the physical and mental impact of the pandemic and the restrictions. We also know there's been a lot of work to get disabled people active at home, but almost a quarter, 23%, said they were less able to be active at home because of a lack of space. This is compared to 18% of non-disabled people. We also know how important carers and other people are to support disabled people to get active, but of course with the pandemic and social distancing, disabled people had less opportunity to see their friends, get support from their friends, and be active with their friends. 16% of disabled people said this was a barrier to being active, compared to only 5% of non-disabled people. The effect on finances and not knowing how to access online sessions were also barriers to exercising, though are less commonly mentioned than the ones above. Moving on to information during the pandemic. 23% of disabled people were more likely to feel they didn't have enough information on how to be active. This was almost twice as many as non-disabled people, 13%. In the survey, we track what sources of information and advice people use. Almost all sources saw a fall in use, except for social media. This reflects the change in circumstances. So libraries, sports clubs, leisure clubs, for example, were obviously less used during this time. However, healthcare professionals and friends and family are still the most common source of information on how to be active. In terms of advice, the top sources or preferred sources of advice remain the same as last year. So healthcare professionals are particularly important, particularly GPs, doctors and nurses. This was who most disabled people wanted to get advice from. However, this year, there were some interesting changes. Disabled people were more willing to listen to their friends and also to the government. So Public Health England, the NHS, the Department of Health. This is particularly interesting. It's doubled from 11 to 22% who want advice from the government. We know that from other surveys that trust in the government has been quite low at certain times, but it seems that the messages and information on physical activity were valuable for disabled people. This year in the survey, we have looked in detail at the differences between different types of disabled people. Like everyone, a range of factors affect the lives of disabled people, so it's important to think about intersectionality and taking a person-centred approach. There's a lot more detail in the report, but from the data, we can see there are a few groups of disabled people whose ability to be active has been more affected by the pandemic. For disabled women, their health and well-being was particularly affected, and they felt they had less opportunity to be active. Younger adults and people from a BME background felt the pandemic reduced their ability to be active, And they also had more significant barriers, such as a lack of space at home. People from a BME background were also more likely to feel the lack of support and work commitments stops them being active. People with multiple impairments are especially affected in a number of different ways. They feel their health has gotten worse and are more likely to experience many of the new barriers, particularly lack of space at home, lack of support, and not having the right equipment. So this is perhaps people who have more specific needs are not feeling included at the moment. They're also more likely to feel they don't have enough information on how to be active. People with different impairment types are all affected in different ways. People with learning and sensory impairments were more likely to feel the pandemic stopped them being as active as they want to be and to experience a lack of support and lack of space at home. Differences for all the other groups can be found in the full report, which you can download on our website. To recap, before the pandemic, there were real positive changes happening for disabled people, with more disabled people being active and perceptions changing. However, the pandemic has disproportionately affected disabled people in many areas. Our research helps us understand how disabled people have been affected. We've seen the progress halted, and we all need to take action to ensure this is not a long-term effect. In response to the findings, we've identified 5 recommendations with action points to minimise the impact of COVID-19 on disabled people's activity levels. You can read more about these in the report. We need to provide clear and consistent information about being active. We need to embed inclusive practice into opportunities as they recover. We need to all work collaboratively to address the new challenges that are arising. We need to offer a variety of ways to be active, and we need to continue to change attitudes towards disabled people in sport and physical activity. We know the sector is experiencing unprecedented challenges. However, it's vital that disabled people are still supported to be as active as they want. These recommendations will help continue the positive progress that was being made to reducing the fairness gap between disabled and non-disabled people's activity levels. You can read in detail on our website more about the recommendations and the report at www.activityalliance.org.uk/annual survey. Please get in touch if we can help your organisation, and please get in touch with me if you have any questions about the research. Thank you.